Well, it was kind of an accident. I originally thought I was going to be an ecologist, study frog populations and their habitats. But then I joined the Peace Corps and was assigned as a science teacher in a rural community outside of the jungle of the Chitwan National Park. And really, it opened my eyes to a lot of different experiences and the hardships many of my students were facing. You know, young girls couldn't go to school when they were menstruating. There were serious considerations around hygiene and sanitation facilities and the availability of those. There are bouts of illness where half my students wouldn't be able to attend classes at any given time, and, you know, inadequate healthcare services. So, but there was one particular situation at my school right after the harvesting season for the rice. I had gone back to school and everybody was in assembly, and the head sir or the principal was making an announcement to the whole student body. And he announced that there was a joint suicide of one of my students and their partner or their boyfriend. And when I had asked later on why, they had said, well, she had become pregnant out of wedlock. And the teachers then followed up and said, well, okay, Garney, what to do? What can we do? It's kind of in resignation, like this is kind of accepted, like we have no power over this thing. But I really felt compelled to do something, but I didn't know what. I wasn't really trained to do any of this. So I called different organizations in Nepal. I talked to people, many people who could offer mental health consultations to my students, anybody who would be able to teach them about reproductive health, because I wasn't an expert in this. And then I started developing this idea around an intervention for my students. But around the same time in Nepal, there was a civil war. And so there was a bombing in my village and I had to be evacuated out of my village. And then a couple of weeks later, I had to be evacuated out of the country because it just kept getting worse. So when I got back to the US, I decided, well, I wanted to keep pursuing this, but what is this called? I had no idea. And I kind of stumbled onto global health as a master's program. I'd been living in Peru prior to starting the Fulbright Fogarty, so I was kind of familiar with what was going on with the COVID-19 pandemic. So we had been evacuated from the country at that time, early 2020, and I came back when they reopened the borders because they had previously closed down all international borders. So I came back at a time that was kind of precarious. They're just getting back into reopening schools. So schools were closed for 2 years. And I really wanted to understand what that was going to do to this population of students. And I was curious to see if it was going to increase rates of school dropout over time or adolescent pregnancy. So I worked with a project called Mamás del Rio and their director, Dr. Magali Blas, and we did our research in the Peruvian Amazon region off the Marañón River in the districts of Nauta and Parinari. So we interviewed about 41 people for our project, and about half of those were adolescents, and not all the adolescents felt comfortable drawing. So at the end of the interview, we'd ask them, well, could you draw your future aspiration? One really simple question. We didn't want to ask them too much. We didn't want to guide them too much. So it was a simple question. We brought all the material and they were able to draw. And we left them for a while and came back. And we found that once we separated across the three groups that we're interviewing, which were non-pregnant adolescent girls, pregnant adolescent girls, and boys, that they had distinct ideas about their aspirations. And what was really striking is that none of them drew wanting to be a mother or father as a future aspiration. And that kind of goes against some of the research I had been reading that said, you know, in order to have the social capital within their communities, young girls may want to pursue being mothers. But that wasn't something that they had aspired to when they were asked. And so they had, you know, the girls who were pregnant drew things that they were familiar with. This included, you know, obstetricians or nurses or teachers that were in the community or people they may have interacted with. Whereas non-pregnant girls, interestingly, could diversify a little bit more. They had a broader scope of what they wanted to do, but it was still within the context of that state or within the Amazon, like within the urban areas of the Amazon. And they envisioned themselves as architects, engineers, or even chefs. And which chefs don't exist in these rural communities, nor do, you know, they don't have really exposure to these other professions. Whereas boys can imagine themselves doing almost anything. They could be doctors, they could be police officers, they could be military, they could be tour guides, but they can envision themselves not just within the Amazon, but in other cities and other places. So it's really interesting to see it because in the interviews, we did interviews too, and we asked the same questions. We didn't get the depth of that information from those interviews that we got from the drawings. The drawings, once you put them together, told a story that was really compelling. My first Fulbright was in 2008 in Nepal, and then this is my second Fulbright as a Fulbright Fogarty in my PhD program to Peru. And I was able to use everything I had previously learned to figure out what I wanted to study and why I wanted to study it, and really develop the research in a way that I felt was going to be helpful. I spent much of my career doing quantitative research, and I really wanted to shift and do some qualitative. I wanted to learn something new, and the Fulbright Fogarty was a great opportunity to really just expand the scope of what I was able to do. And so they gave me an opportunity to a multi-dimensional research project, and I incorporated different things I hadn't ever thought about, like drawings, into a qualitative research project, and exploring poetic inquiry and digital storytelling in addition to, focus group discussions and interviews. So we started something called Beyond Global Health, which is, with my mentor, Dr. Purnima Madhyavanan, and a fellow Fogarty scholar, we developed a site or a place where people could really bring their art and their poetry and their prose and their photography and really talk to global health issues, and in a way also decolonize the field. So we wanted to keep it as a space that really elevated the voices of our participants, and as a space that could promote social change and awareness. Some of these girls were as young as 12. I have an 11-year-old at home, and for me, it's really hard to emotionally disconnect from this experience. And that's just young. And a lot of it has to speak to sexual violence. I mean, you don't have a lot of autonomy. These women, girls do not have autonomy. And it really sets them up to have a different life trajectory when they have children at a very young age. Maybe even 15 or 16 would lead them to a different life trajectory. 12 is very, very young. And these girls don't have, they're not fully developed women, and they're at higher risk for, mortality and morbidity due to having children at a very young age. So, outside of just the physical of what's going to physically what's going to happen to them, you have to think about them mentally. Are they mentally prepared to care for another child? What's their mental health going to look like? Was this experience in which they got pregnant coerced in any way? There's a lot of different questions around what's happening to these young girls, and are we doing enough to protect them? What we find is that many people want to fund interventions in more populated areas because the transportation working on the Amazon River is very, very, very difficult. And transportation is a key issue. And so it's really hard to do an intervention when your population is super rural and super isolated. And so a lot of the funding wants to go to maybe more populated areas, like maybe the city of Iquitos or the city of Nauta, but they don't really want to go deep into the forest to provide services because it's just really difficult, really costly. So how do we do this with the resources we have? And how do we do it that is really tailored to the specific needs of that population? I think I was super lucky. It just started and my PhD program, and I was looking through all the faculty lists. I wanted to find somebody that was more aligned with what I wanted to study. So I went through the list and I found Dr. Purnima Madhyavanan, and I remember just sending her this email, gushing, be like, I really want to be you when I grow up. And she writes back like, let's meet. And so this is even before I officially started my first day of school. And she was just great. And I knew that from that moment that I really wanted to work with her. And so finding a mentor that is really going to help you and guide you and willing to guide you is really important, because I think we all have some mentors who are there on paper, but that really we don't talk to or have a personal connection with. but really find that mentor who's willing to give you their time. That's one of their most valuable commodities is their time. Through her, I was able to find my project through Dr. Magali Blas, and from there, it's been great. I really appreciate these women. In October 2023, I don't know if you guys remember or if you remember the news that were coming out around the Amazon. They're facing one of the biggest droughts they've ever seen. The temperatures were some of the highest it's ever been in the recorded history in 120 years. And I'm in the Amazon during this really, really hot period drought. And, you know, a lot of it had to do with the El Nino effect, but because of climate change, it was exacerbated. And what we're seeing is that the river levels were super low. You can walk across parts of the river that people hadn't been able to walk. People were really struggling to get food, for transportation, for clean water. I think Brazil was much more impacted than Peru at this time. But, you know, climate change is affecting everything. It's affecting women's health. It's affecting reproductive health. It's affecting food security. There's a lot of gender inequality when we look at climate change and climate change adaptations. So our participants are noticing this. They're very aware of what's happening. They're like, this is the hottest it's ever been. We can't find food in the rivers that we usually frequent. We have to go deeper and deeper into the Amazon to find the fish. And so this has led to other issues of food security. And so I think that whatever we do in the future, we have to think about climate change in whatever research and whatever capacity, because it's everywhere and people are experiencing it. And if we don't incorporate climate change, even if it's not your general focus, then we're missing important parts of our data. You know, I really think that we need to focus also not only on climate change, but women and empowering women. We want to change the life trajectory of people, focus on women. They'll change the life trajectories of their children, and that will make a huge, huge difference. But, you know, they lack resources. And especially in climate change, you know, we don't really have climate change adaptation strategies, or climate change in general is not gender neutral. So we need to really think about how we're moving forward. And even in the work I'm doing now, adolescent pregnancy, you know, I'm seeing how transportation is going to be a major issue for these young girls to get contraceptives. They're not able to get it because the rivers are too low and they're not able to go to the clinic, or the clinic cannot come to them. So they're going to be even more isolated pockets. So that's probably one of the key things I think about if we're moving forward in global health, is really focusing on women and children. So we began this in March, and it's been a slow beginning to get people to really be interested in this idea, because it really melds together, you know, the science of global health with this more artistic approach. And art has been shown to really provide a space where people can connect with others in a way that maybe our scientific and academic papers may not allow us to do. So it's been a slow start. We've had a few entries. We're going to probably do a second call coming up in the next month or so, just to allow more people to provide us with more entries. And I think because this is such a novel idea and people hadn't been thinking about it before, maybe allowing more time for some of the new fellows through the launch program, or other scientists to really dive into their artistic side. Because I know many people who are in the global health field who take, you know, may not be professional photographers, but may love to take photos, or who love to draw, or who love to write poetry. But now this is an opportunity where they can meld their two loves together, and really a space where they can share, and maybe even share some of what their participants are saying and doing, because those are the most powerful stories. You know, the data can only show you so much, but if we don't know the stories behind that data, then how can you have an emotional connection to what's going on and care deeply about the lives of other people? So right now we're taking the research we did in Peru, And we've applied for several different grants because I learned a lot and I thought it was really valuable and I wanted to give it back to the population. So we're working on doing booklets that are tailored to adolescents with all the data and key information that we want them to learn and know, and addressing some of their misconceptions, but also allowing them to have a say in what was going to happen next. So following this booklet that we'll be distributing in July, we will then convene as a group, different community leaders, tribal leaders, community health workers, and youth, and try to come up with an idea for a intervention.